Opening an account is such a headache, and in most cases, filling out long forms, slow responses from the bank, and the sheer amount of documents I need to put together. I am someone who likes things simplified, and that is why I am looking forward to using the Jupiter Money app. It's a digital banking app that simplifies banking. Take opening an account, for example. It's completely paperless, and in fact, your PAN card and Aadhaar card are the only things that you need. The whole process takes only 2-3 minutes, and it's super easy to understand. You can check out Jupiter.money to know more, or download the Jupiter app on Android and iOS to get started. Hello and welcome to the Habit Coach podcast. I'm Ashdin, Doctor, your habit coach, and today we're going to be talking about how to get over the habits of smoking or tobacco and the addictions that are there, and how can you reverse all the damage that has been taking place to you, or what are the steps that you can take towards that. And for that, we have an expert with us, Dr. Richa Mittal. And we did a podcast on World Anti-Tobacco Day because we were understanding what is the effect of tobacco. Please do make sure you listen to that episode. Today, we're going to be talking about if you are addicted to tobacco or if you have somebody in your family who's addicted to tobacco, what can we do about it? So, Dr. Mittal, welcome back to the Habit Coach podcast.
Hi everyone. Hi Ashton. Thanks for welcoming me again.
I loved our first episode because there's so much I had no idea about and the effects that take place in our body because of smoking. We normally think lungs, 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 and you may give one laundry list of things that I had absolutely no clue to. So, Dr. Mittal, one is, it becomes this addictive habit, right? When you meet your patients, how do you first guide them out of it and how do you help them give up this habit of smoking?
So in first go it will never be give up, because more than half of smokers they want to quit. But only one third or maybe just less than that will turn up to you. So first thing is you basically ask. You will not get always get the right answers also whether you smoke or not. Then you assess their willingness, basically, whether they want to quit or not, whether they're contemplating about it, which zone are they in, where they are in this pre-contemplation, they're contemplating whether they want to act on it, they want to plan it out. So you assess where exactly they are in their position to quit smoking. Then maybe, if they're ready, if they're willing for that, tell them. If they're not willing for them, even then, tell them what are the adverse effects, why they should think about it, why they should discuss with their family, and not just their well-being, their family well-being, economic, issues, because they're spending so much money is going on cigarettes. These are not cheap substances. So we need to talk about every aspect of that, and we need to see what can click with that patient and with that person. Give them a plan if they're ready for it. Arrange a follow-up. That's a must. I will try to take down their number, and maybe, on a personal note, I will try to connect with them, because stopping, quitting smoking is not easy. There'll be multiple relapses. A person who even wants to quit smoking, it's difficult. It's all psychological. It's not physical, as we talked about the last time. It's not physical. It's psychological. There will be relapses, and we need to encourage at every step we can as a physician, and even the family. Family has a big role to play in this.
That two, three important things that you said, I want to just highlight these because, even as a habit coach, people keep coming and saying, oh, I have so many bad habits. Smoking is one of them. I want to give it up. So I was like, do you really want to give it up? No, my wife tells me I should stop smoking and my kids tell me I should stop smoking, but I don't really want to. So like, if you don't want to, there's no chance that you're actually going to end up giving it. So
Yes.
only once there's that
Yes.
big need from your inside, like an internal need, will you actually go and act upon it.
Yes, so very true. It has to come from inside,
It has
It
to come
has to
from inside.
start from, yeah.
And do you just scare the person with, this is what happened to you, this is what happened to you? Because that is technically like, the way that especially family members try and talk to their, the smoker and the family, saying that, oh, you will die of this and this will happen to you and you'll get cancer and all of that. They're just trying to scare the person. The person knows all these things. So how
So
do
no,
you?
yeah, I don't. Maybe
Okay.
yes, I'll give him a list, and not even list, just a gist of what all can happen. But
Mm.
scaring won't really help. Scaring has not helped anyone, I think.
It hasn't
But
ever, right?
yes.
Mm,
So all we can tell him that it's normal.
mm,
That it will. will be difficult, and but it's possible. It's a long journey. Yes, you have to prepare them. It's going to be a long journey. It's not, there will be no shortcuts, because even if they leave cold turkey, but there will be relapses. So we have to prepare them. That's a long battle ahead, but yes, we are with them. And it's always better that we give them combination therapy. There is always this behavioral therapy and medicinal part going hand in hand, and we are there with them, like frequent follow-ups. And it's always better to enroll them in a smoking cessation program, or if you have these specialty clinics, no tobacco clinics at your hospital, it's always better there. I'm so sorry, we'll have to stop that.
No stress. That's what my engineer is about.
It's
He'll go
very
slow.
loose actually.
I think you have to put it on again. It's fallen at the back of your head.
Yeah,
Take it off
it's
and put
very
it again.
loose.
It should be on the top, like
Ah, now it's fine.
better.
Mm,
Hmm.
I'm so sorry.
You want to take it off once and rewear it?
No, it will be very difficult. There'll be too many. What's going on? uh,
Hmm. No stress. No stress. Okay. So, doctor, you were talking about, people should, sign up for a program or start a program, or then the giving up cold turkey. I think there are too many different modalities that are there when it comes to giving up smoking. Which is the kind that you've seen work the best? Like, do you taper it off? Do you go kachak, no more from tomorrow? What is the way that it works best?
Cold turkey works wonders for some, because there's always a trigger for that. Many times, like I have seen patients leaving it just suddenly, because they will get this transient attack. There was one patient who get this transient paralytic attack, and just his hands, he was not able to lift up, and the next day I don't know what went in mind, he just quit smoking, just like that. So it works. Cold turkey
But we
definitely
can't have
works.
something like that happen to us before we quit
Yes,
smoke. That is
yes.
like,
So that's there. So cold turkey definitely works better, but it could be a gradual process also. It depends on the willingness of the person. It depends
Hmm.
on what's going in his mind. It depends what's triggering that quit, that he wants to quit now. It all depends on his willpower and how strong he's feeling about quitting smoking.
So willpower is a very important aspect in this,
Very
or is it a
important.
process that is more important?
Process also, but yes, willpower has a great role to play, because again, then it all comes down to, it's all psychological addiction. It's not
Okay.
physical much, it's more of a psychological addiction. Like alcohol, quitting alcohol requires a lot of effort, because it's a more of physical dependency. But here in smoking, it's psychological. If even if you smell the smoke of a cigarette, you'll feel like smoking, you'll have
Hmm.
that craving, you'll go back, and you might
Or if the
relapse.
weather is perfect, or you remember one. So I think it's all these cues that come in that are
Yeah.
set in our mind that bring us back to the cigarette.
Yes.
Can you walk us through a typical program? What would it typically look like? What are the aspects of it? Like, is it a day-to-day thing? Is it a weekly thing? How does it work?
So not day to day thing. So once a person is ready, we first ask him for a quit date. That's decide your
Oh, that's a
quit
quit
date.
date. Nice.
Yes, you
Hmm.
decide to quit it, because the therapy also differs. Now we have a medical and non-medical therapies. In non-medical, there are many. The one behavioral therapy is one where we do counseling sessions with the person, one-on-one, face-to-face, and also with the partner maybe, or family members who are involved. And counseling sessions work really well, and they help you with the medical part also. Then we have helpline numbers. There is a national, it's set by a government, and there's a national helpline, quit smoking helpline number, where there are trained coaches and their counselors that help you with the quitting date process. If you have withdrawal symptoms, they'll help you with the guidance of like where you can get drugs from. They'll help you with relapses also. And it's 24 hours available. This helpline is available 24 hours. And through that we can go. And then there are multiple other non-medical modalities, like you know, acupuncture. Now, how does acupuncture helps? Because you're pressing those points of the body which help release endorphins. Now, these endorphins, they are basically chemicals in your body which helps you, which makes you feel better and gives you pleasure. So it decreases the withdrawal symptoms, the intensity of the withdrawal symptoms. You will feel less, and it overall increases your mental well-being. So acupuncture helps, yoga helps. So even yoga helps, meditation,
How does yoga help?
mindfulness. So all these basically they all release, they help. Yoga also, it helps you release endorphins. You feel good after you do, see, after you do exercise, after you do workout, you feel good about yourself because
Correct.
these hormones get secreted. You feel better about yourself, you feel better about your whole body, you have a better mental health, and you're more in control. Your blood pressure, your heart is at a much better state when you do exercises, especially yoga. So that's even Tai Chi for that matter. It's a form of exercise. And you do 2 to 3 times a week, just 2 to 3 times a week, and it helps you. And these all are basically supportive therapies for your, that goes with, that aids in smoking cessation, but they go with the medical treatment. We do have medical treatment also. And there
Hmm.
are certain drugs which are available over the counter, nicotine patch or gums, if you've heard, because it's so commonly available. That is something you can go and take also. And it depends, the dose of that depends on how many cigarettes you were smoking in a day. So once you decide that today is my quit date, you will if you're using these nicotine replacement therapy, then you will have to quit before starting these therapies. It's better. But there are other drugs. There are two other drugs which are approved for the cessation of smoking, and these are varenicline and bupropion. With these drugs you can continue to smoke for a week's time, or maybe 2 weeks time, or maybe you can set a plan that in the next 4 weeks I will gradually taper my number of cigarettes, and you can continue to take the drugs also. It's possible with them. So we decide on a case to case basis whether he wants to stop it today, he wants to go ahead with a quit date, or maybe not a quit date, he wants to start reducing from now on. And that's how we modify the plan on the case to case basis. If the person is deciding that no, I don't want to quit now, I just want to decrease, maybe I'll start him on the drugs. And varenicline is the most effective that we have seen from the evidence also in clinics also.
How
It's the
do the
most
drugs work?
effective. Yeah. So in nicotine replacement therapy, basically what we are doing is we are not giving nicotine through the smoke and causing its harmful effect. We are giving nicotine in other ways, like through a patch that we apply in any non-hairy site of our body, or through a gum. And how does a gum work? And then it will give you those pleasurable effects, and you won't have the withdrawal symptoms, because those withdrawal symptoms are so disturbing, and that makes you relapse and go back to smoking a cigarette.
Correct.
And how does a, like a patch, if you apply, it will work for, it's a very long acting thing, it will work for 24 hours. So you apply patch once, and the next morning you change the pack and apply a new one. It will keep releasing nicotine and it will get absorbed in your body, and you will feel better and you won't feel that urge. But there will be, sometimes there will be urges, there will be triggers, and for that you can club it up with gums. And how do you take nicotine gums is basically they're available in two doses, and it all depends. A smaller dose you take when you are having maybe less than 10 cigarettes a day, and you take higher dose if you're having more than half a pack, that's 10 cigarettes a day. But there's a way of taking these nicotine gum. It's basically a technique known as chew and park technique.
Hmm.
So you take a gum, you keep chewing it till you have the, till you get that taste of nicotine, and then you park that gum in between your buccal mucosa and teeth, and then you let it be there. And once that taste goes away, then again you take it back and chew it, and then again you'll get the taste, and then you will park it again. So it's a chew and park technique, and you can use and for a good half an hour, and you can actually take it more than 20 24 in a day. So these gums basically help you with urges, and the patch is there to stay for long for a baseline level of nicotine. And that's how nicotine replacement therapies work, and you can take it over the counter, it's easily available. But then there are drugs like varenicline and bupropion. How do they work? They basically, so varenicline works when you smoke, so that nicotine will give you those pleasurable effects, it will block those effects. So even if you smoke, you won't get those rewarding effects. And it works in a different way also. There is that it, in your body it will make you feel that nicotine is being released, like it will make you feel good about you also. It will um, increase the release of certain hormones that will make you feel good, so you won't get those disturbing effects also. And in a way it's working also that you will feel good about yourself. And same as bupropion. So bupropion is another antidepressant drug actually, and I tend to use in people who are smokers and are also depressed also. And because again it releases dopamine, And then again, this is a chemical which makes you feel good, make you feel better about yourself, and that's how it all these drugs work. We are replacing the nicotine that is being given in this, that's there in cigarette. We are replacing with external nicotine and also certain hormones that will make you feel good and will not make you feel those withdrawal symptoms. The aim is that the person should not feel, they should not have those disturbing or those unpleasurable withdrawal symptoms, because
What
that's
happens
what.
during the withdrawal symptoms
So
typically?
a person, yeah, so it's a person is very irritable. He's
Hmm.
very he'll have sleepless nights. There's, and usually the withdrawal symptoms are quite high in the first 3 4 days. So he will be agitated, irritated, he'll have sleepless nights, there will be weight gain also, there'll be increased appetite, and poor memory, and yeah, vivid dreams. So all this, it's more of a cognition and psychological issue.
So they're also then having a horrible time. So it's
Yes,
pulling them
yes,
back into it. And you would
yes.
never mix the drugs and the nicotine, right? Because the nicotine therapy is completely different and the drugs is completely different.
No, we do mix that.
You would have an overlap as well.
No, you saying ki the other drugs with nicotine? No, we don't
Mm,
really do that. Yes, but in
correct.
some cases where it's not working, we might do that with the patch.
Hello, hello, hello. It's been another great week on the IVM Podcast Network. On This Round is on me, food writer Sonal Ved shares valuable advice for budding food writers with Gauri. On Naan Curry, Sadaf and Archit do a rundown of India's most popular biscuit, Parle Chi. On Misconduct, Ragvi and Nisha introduce us to Kamlavali Arumagam, the woman responsible for the Pazi fraud. On The Longest Constitution, Priya explores the journey of free speech in India. And on Audio Gyan, Kedar talks about game design with the director of design at Zynga, Purnima Sitaraman. We've got some exciting news for you. IVM Podcast has launched merchandise and our first line is out now. Head to the IVM Podcast website and click on the shop tab and check out the first collection of t-shirts. Do follow us on social media as well. We're IVM Podcast on Twitter, Facebook, Instagram, and LinkedIn. And remember, if you're enjoying this show or any of our other shows for that matter, please do tell a friend. Also, don't forget to rate us on any of the platforms you're listening to us on, whether it's Spotify, whether it's Apple, wherever you do that, that is really helpful for us. And do remember, you can also check a lot of our shows out on YouTube. If you go to ivmpodcast.com/YouTube, you get a list of all of our channels. We're also doing a small listener survey, so please do help us out with that. If you go to ivmpodcast.com/survey, it'll help us understand a little bit more about our listeners. And finally, we'd like to thank our sponsors this week, SBI Life Insurance, Jupiter, a digital banking app, and Capgemini. Get the future you want. Thank you so much. Without you guys, this wouldn't be possible.
And when somebody is now using the patch or chewing gum, how do you get them off those? Because that is also technically addictive, right?
Yeah, so that's what the process has to be very gradual. We have to understand. So for the first, maybe, a month, don't touch anything. If the person is taking a certain amount, maybe he's, X amount of gums a day, let him be. Just don't, push him that, start reducing it in the first week only. No, it has to be very gradual, be very soft on the person because he's going through a lot mentally.
Hmm.
So maybe just after 4 weeks, after 3 weeks, maybe you can, start decreasing, gradually tapering down the number of gums. First, you taper down the number of gums. You come down to a state where you are not using gums much, and then you're just using the patch. And then we'll try and taper down the patch also, maybe alternate days. This will be a gradual process over, usually over 3 months. Sometimes we extend it for 6 months. And usually we have seen if a person is able to tolerate till 6 months without smoking, he'll be like, the abstinence will be for a good years. There are relapses, yes.
Hmm.
There are relapses, more so in the first year, there are relapses, but then we can tackle them. But a person who gets through the first 3 to 6 months usually will be able
Stick
to
it through.
abstain himself from, yeah, yeah.
And is there a thing like after you quit smoking, even if you have one cigarette, you back it to square one, or
No, not really that you're back. See, again, it comes down to willpower. So, yeah, maybe he'll come back to the clinician who's treating him, or maybe a partner, or maybe a family member whom he feels trusted with, and where. So that's why counseling of family is very important. Who's
hmm.
the one he trusts and who's the one he's close to, because they are also the um, they are also the aides in this whole process. So this is not just, yes, the patient is the primary person, but then there are other people. The environment has to be quite soft too.
In fact, when I work with people on their habits and smoking as a habit, I keep telling them that. for many people, the addictive part is the situation. I'm out with friends, I will have my cigarette there, or with drinks, or whenever I come back from work, I will have that cigarette, or
Very
so
true.
you start connecting that cigarette with that moment, and then those moments happen every day. So now, as soon as that moment happens, you're suddenly thinking about, "Arey, where's my cigarette? Where's my cigarette?"
Yeah.
And it is that connection that you have to break. And like you said, it's a psychological connection that you have to break, which is far more difficult than just the
Yes.
physical addiction.
Yes. So for the first 3 to 6 months, see, alcohol is a major trigger.
Mm.
They usually go hand in hand. And then again, we talked about how tea is the major trigger. So people who are heavy smokers, they're used to having many frequent cups of teas. So we need to avoid
Morning
these triggers
toilet,
also. Yes.
right? Morning
Yeah,
toilet.
yeah.
Mm. I,
And that's, you ask for withdrawal symptoms, people get constipated, and that's what
I,
it causes the relapse. No, matlab, I'm getting
bowel is too
constipated.
important, especially us Indians. So, matlab, if you haven't gone in the morning, to your entire day is ruined. Absolutely. So
uh,
these kinds of things help people relapse into smoking.
yes, yes.
What is the role of the family in all of this? So, say a person's listening to this and their loved one is smoking. What are the steps that the person should be doing in order to help the smoker?
Again, if going out, don't order drinks. This small steps that you can take. If the person is trying to work more on it, more on his or her health, you can do too, so that it can be a combined effort. It could be a teamwork. You can think about not just healthy habits, healthy habits about smoking only, healthy diet. Because overall, if you feel good about yourself, you're more motivated. You can
Correct.
encourage the other person. Maybe ignore certain negative things. If you in that phase, if you are, even if you feel certain things, ignore those negative parts, because you need to encourage them, be very positive, and realize that there will be relapses, and you will have to stand by him or her. So again, the family has a major role to play, I feel.
I feel so too because we were doing an Ask Me Anything on Instagram I think a few years ago, a year or so ago, and we were talking about this. And she was saying, I'm constantly telling my husband, stop smoking, stop smoking, stop smoking. I told her that you're probably just nagging him so much
I,
that
I
that's
was I
causing
was
more
about to say
stress.
that nagging is never going to help. It's not
Nagging is
help
never going to
anyone,
help.
although
Yeah.
it's inbuilt in us.
If I
but
don't nag, what will I do?
we can't help it. But then we have to realize that it's not just for his good, it's for your good only. And
Correct.
if both of you are aiming that you want him or her to quit smoking, then you both have to work as a team. And nagging is not going to help you. So yeah, teamwork is going to help.
Teamwork's important. Like you said, one is not trying to scare the person into submission. The second one is don't try and nag the person to submission. Instead, you have to
Although
create a
we
safe
should
space
be
for this person.
space and rewarding. Even
Correct.
small step of his, that even if he's able to reduce his 10 to 8, or maybe 10 to 6, you should be thinking of rewarding gestures for
Correct.
him or her.
So true. It's not like absolutely. Reward even the small changes. Oh, you don't smell like smoke today. That even that
Treat like a
small,
kid.
yeah, right. It's almost like that. You have to create a safe space, make it fun for the
Yeah.
person to look forward to giving it up. Smoke in order to feel better. This is going to be an issue with it.
Yes, yes.
So more stress, no. Now, doctor, tell me, say somebody's listening to our podcast and they're saying, yes, I'm going to give up smoking from today onwards. How do I reverse all the scary stuff that you told me in episode one? Right? How do I reverse the ill effects of smoking?
So good part about smoking is that actually that once you stop smoking, over the years, over the weeks, things will get reversed. Maybe
Okay,
not to the baseline level, what you were at before you started smoking, but definitely you see a trajectory towards a better effect, that things reverse. Like just let's just talk about voice for that matter. Voice does get deeper when you're a heavy smoker. Your tone changes, your pitch changes. It reverses once you quit smoking, and within days also we've seen. For some it takes weeks, but within days also it's seen. We talk about lung function, we talk about asthma, we talked about COPD. Now these diseases also, they improve they improve much. They improve drastically once you stop smoking, and you actually reach the level of a non-smoker in few years. So a lot of things, yes. Cancer is something that you cannot reverse, but what you can reverse is in the cancer also when you quit smoking, recovery, because you have a delayed recovery if you continue to smoke. There are a lot of drugs that their metabolism that if gets affected if you are smoking, then your recovery again will be much better if you stop smoking. Even a person who's going for surgery, even as small as an eye surgery, for just cataract surgery also, if he's smoking, then also it affects it, the post-op period is affected by your smoking level. So a lot
Correct.
of things, so that, and just 2 months of quitting smoking, it will actually reverse the whole effects. So the good thing about smoking is that things do reverse. Maybe it will take time, maybe it will just reverse over the days, but it does so.
And if you look at someone's body 15 years after they've stopped smoking, would you ever be able to tell that they smoked at one point of time? Would all the effects have disappeared by then?
Yeah, probably looking at the lungs, yes.
You would still be
Because
able to see.
that, because the tar will be there, yes, the staining and all will be there.
Oh, it doesn't go
But
anywhere.
but this at the cellular level, no, matlab, we're not going into that, but at the microscopic level, yes, much of it would have been changed. 15 years is a very long time. If someone is able to quit smoking for 15 years, he's as good as a non-smoker then
Correct.
there are certain, no, but then we have to realize that if we smoked for maybe 20 years, 30 years, then there are certain effects that can come even after quitting smoking. It can come,
Mm,
your lung diseases. There are other
right.
diseases also, even cancers, they can come after you've quit smoking. So it all depends how many years and how many cigarettes you've smoked. That is something we call as pack years in the medical term. How many
Oh, the
cigarettes you have
accurate. Okay. Right.
Yes. So how many cigarettes you've smoked, how many years you smoked, it all
Mm,
affects that. But definitely, if you quit smoking, even today, even at the age of 70, even at the age of 60, it will have some good effects. Yes,
mm.
because every smoke that you're inhaling, it is changing your body's cells, it is changing the whole DNA, and it is modifying your body.
It's modifying the body in some way or
Yes,
fashion, at least.
yes.
Now, if somebody's been smoking, like you said, 15 years or 5 years or 20 years, are there any tests that you can do to see what damage has happened? What is the extent? What do your lungs look like? Like if somebody's listening to this and saying that, yeah, I want to check like what has happened to my body with all the smoking. What can people do?
Yeah, so we do have lung function tests that is known
Okay.
as pulmonary function tests, and a smaller version of that is spirometry, with which we check how effective your lung is working,
Those are
and
those
if
three
there is
balls that
any
you inhale and you. Those are
and
those
if
three
there is
balls that
any
you inhale and you float those.
Yes, yes.
Hmm,
You blow out, as hard and as fast as you can in a machine, and then it checks your lung volumes basically, and we can
correct.
just judge whether your airways, the path with which you breathe, is narrowed or not. These are some screening tests that we can do, and definitely meeting a clinician if you have any symptoms will help you. But
So,
yes,
do you
lung
think
function,
that you
pulmonary
should go
function.
to a doctor for sure if you're smoking? Like, what would the steps be? Would you try
No,
squirting by
not
yourself
every
before you go to a
smoker.
doctor?
No, not every smoke. Yes, if you're trying to quit, see, first you can try it yourself also. If you're not a heavy smoker, definitely you can try and quit with your family and with yourself. You can try and set a quit date, and you can make use of these nicotine patch and gums. You can do that. But definitely with a clinician, it's better. With a physician, it's better, because you get those non-medical treatment also, the behavioral therapy, and you get a structured and more organized way. And for heavy smokers, it's difficult. So you need someone to guide you. Like, you for if you want to lose some weight, you usually go for trainers. So
Correct.
basically, you need a coach, and now you have, that's what I talked about. Now you have this quit smoking helpline. It's a national
Correct.
helpline. You have
Are they
trained
good?
coaches. Yes, they are trained coaches and counselor, which are available 24/7, and you can reach out to them. They will give you a plan also, and they'll help you with withdrawals also.
Fantastic. If we can find the number, we'll put it in our show notes
Yeah.
as well, so people can reach out to them.
Sure, sure.
Doctor, when people are going through this process of recovery from smoking, what are some of the difficulties that they'll face? If you can talk about two, three, difficulties you typically see in your patients. So we know that these are speed breakers that everyone might face. What would those kind of things be?
See, triggers or cues, as you said, that alcohol, the environment, the ambience, and just the situation, how it is, that going out with friends. So these triggers, avoiding those triggers, and in general, alcohol, caffeine, stress in life, stress in life, personal or maybe professional, any stress, managing it better. So these things, and then balancing other aspects of your life also, mental well-being, and that's where yoga, acupuncture, they come into play, because your overall mental well-being will be better, and because you need that in a healthy diet, keeping yourself hydrated, all these things, they help. And these are things, and they will, because these are the things that will trigger relapses. So relapses is something. And then there are symptoms, withdrawal symptoms, they are very disturbing. These irritation, being anxious, being fidgety,
Mhm.
and not able to sleep well, and then in the next morning you are feeling all fatigued, tired. So it's not a good feeling. Your appetite is increased, you are gaining weight, and so everything, the it's like a double whammy thing. It's like you are going, the negative effects are too many.
Correct. In
Yeah,
fact,
so we need
when
to
you were
tackle
talking
those.
about when you were talking about the lifestyle changes, I was remembering saying that there's so many people that when you start working with and you start doing the lifestyle changes first, automatically, eventually, one penny drops in their mind saying that if I'm making so much hard work in my exercise and my nutrition and all of that and meditation, why am I smoking? And
Yeah,
automatically, it falls by the wayside, saying they don't
yes.
need it anymore. They're not necessarily in that need for it.
Yeah. And those pleasures which you were trying to find with the smoke, you start getting with this healthy lifestyle also, because again, let's, as we talked about, exercise does really release endorphins, and these are the chemicals which actually make you feel good about yourself. So exercise, working out, and even you don't have to go for a full strength or endurance training, also just weight training, nothing like that. You just, so simple measures like yoga, meditation, these also help.
Perfect. Super. Doctor, is there anything else that we missed out on the recovery journey for people who are addicted to tobacco that you can think of?
No, all I would like to say is, just go in that contemplation mode, you know, and start thinking about why you want to quit. And maybe our podcast helped you. And start planning out, have people around you, realize that it's going to be a long battle, and be prepared for it. And overall, in general, in every aspect of your life, try to achieve balance, because, and then probably, try to achieve balance within you, because that's how you'll get the balance in life. And it all starts from within you.
I love it. Get your intention right, get the reason why you want to quit right, and then the quitting will become much easier. Absolutely love it. Dr. Mittal, how can people get in touch with you? How can people continue this conversation with you?
Sure. So I think we'll drop the link, and they can reach out to me through Instagram or Facebook via of Sir Richard Reliance Foundation Hospital, and that's where they can connect. And
Perfect.
we can drop the link also.
We'll definitely put it down in the show notes below. Dr. Mittal, thank you so much for coming on the Habit Coach podcast. I absolutely love
Thank you
talking to you.
so much for having me. Same here.
Thank you.